Today, let's talk about liposuction of the neck. Liposuction, as you probably know, is a procedure where we suck out fat, and I can do this anywhere in the body. Commonly, I do liposuction on the abdomen to remove some of that fat, the flanks or the love handles, the back, the thighs, and even the chest in men who have enlargement of the chest tissue. Another area where I can suck out fat is the neck. People often hate their neck, and the thing that they don't like is that extra hang of stuff down here. Now that stuff may be extra skin, so if you're older or you've lost weight, your skin can sag here in the neck just like it can sag anywhere on the body. But that's not what we're talking about, because as you should know, liposuction doesn't do anything for skin. It specifically addresses excess fat. So on your neck, if you want to know if it's skin or fat, what you do is pinch it. And I'll use my neck as an example because I'm not afraid to show you that I got some fat here. When you pinch your neck, if it feels really thin and you can kind of roll it between your fingers, that's skin. And treatment of extra skin on the neck may be something like a neck lift where skin is pulled tight and removed. But what if you pinch it and it's thicker and you feel like there's stuff between your fingers on your neck? That would be fat, but it only takes a little bit of fat to give you that appearance of a rounded neck, or the kind of that double chin thing that people talk about. So what can we do about it? Well, we can suck it out using liposuction. The way the procedure is done is we fill up this area with a numbing medicine, so we get everything nice and numb, and it also plumps up the area. Then I make a small little opening, and I do it in that little crease under your chin. Commonly, people already have scars there because when you were a child, maybe you fell and you kind of hit the corner of the coffee table with your chin, and maybe you had a cut there or you had some stitches. So that area is really well hidden. So I usually find a nice natural crease and make a small little opening. It doesn't have to be big at all. Then what I do is I suck out the fat. And I do it with something like this, which is a cannula. This is a small cannula, and it has holes in the side. And this is attached to a suctioning machine so that there's suction that goes through this to pull the fat out from your neck, through the cannula, and into a container. So the way it works is this cannula is put in through this little opening under the chin that I made, and I'm able to suction in this direction. And you can see by doing it like this, I'm able to get out this fat. And then, in order to help define the jawline, I can go in this direction. And we can do it on both sides. So by doing that, I can get rid of this extra stuff that you can pinch, and I can help define the jawline just to give you a much more defined profile. And you can see with liposuction of the neck, you can get a really nice improvement in someone's appearance. It makes them look younger, it makes them look thinner, and it's a relatively short procedure and simple recovery. Sometimes when you gain weight, the fat goes to your face and your neck first, and this is what happens with me. So by doing some liposuction of the neck, it's going to make you look thinner. It's also going to make you look younger because the neck has been said to be one of the first places on your body to kind of start to show your age. The other thing that I find great about neck liposuction is it's relatively easy for you to have done. If you're having some other procedure, like say we're doing some breast implants or a tummy tuck, then it's very easy for me to just add on liposuction of your neck so that you're having it done at the same time as the other procedures. But if you were coming in and you only wanted liposuction of your neck, we can do it under just local anesthesia. This means that you can stay awake. Don't worry, you're not going to feel anything. And once the procedure is done, you get to go home and you don't have any of the after effects of general anesthesia where you might feel groggy or nauseous or kind of foggy for a few hours or even a few days. So when you come to me to have your neck liposuction under local anesthesia, you come into the office, I'll mark those areas. We'll get that area nice and numb and sleepy so you don't feel anything. I'll do the suctioning or removing of the fat, which usually takes about 15-20 minutes. And then afterwards, you get to go home. with just one single little stitch in that opening that will fall out on its own. Afterwards, we will make you wear a funny looking head strap because that's going to give some compression to the area in order to help reduce the swelling and the bruising that you may experience. The recovery from neck liposuction is relatively simple. I refer to it more as a social recovery because it's not really a painful thing and it's not going to prevent you from doing normal things. However, you will be a little bit bruised and you will be a little bit swollen, so you're not going to love the way you look for the first week. But that's why I call it a social recovery, because you're going to feel fine, but you may not look that great, and there are going to be certain people or certain activities or events that you may want to avoid for about a week. I'm Dr. Matthew Schulman, board-certified plastic surgeon here in New York City. Hopefully you enjoyed this information about neck liposuction. As always, if you like this video, make sure to like, comment, and share. And don't forget to check out all the other videos I have on my YouTube channel.